Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. Today, I want to talk a little bit about suctioning. You know, a lot of patients we come in contact with, we have to suction their airways, and there are different routes we can use for suctioning. And this is going to depend upon, of course, your protocols, your training, whether you're doing emergency care or even interfacility transports. So it's important to note that not all suctioning is created equal, right? Because there's different catheter sizes we might want to use, different devices we might want to use, different devices that are available to us. Sometimes it's a manual device, sometimes it's a a mechanical device. Okay, so it's all going to depend upon what we're using and how we're accessing the patient's airway and how we're going to be suctioning. So I want to just talk a little bit about the different routes that we're going to use. One is the oral route. Okay, this is where it's involving, of course, obviously the mouth, right? These are secretions that might be in there: sputum, saliva, vomitus, maybe blood, and this is usually done with a Yankauer suction catheter. Now, solid objects can't be removed with a Yankauer device, but you're going to have to do things if you have a patient, let's say they have dislodged teeth or very thick vomitus. You might have to go ahead and manually remove this type of obstruction with a gloved hand or with a McGill forceps, depending upon, again, the condition of the patient, if they're conscious, unconscious, and things like that. Now, oropharyngeal suctioning, the oropharynx extends from the lips to the pharynx, and the oropharyngeal suctioning is going to require you to insert the catheter through the mouth and into the pharynx or the trachea in order to remove those secretions. Now, patients that usually need this form of suctioning usually can't maintain their own airway. Okay, and you're going to have an OPA inserted, an oropharyngeal airway inserted. Okay, and this airway is going to help you assist in suctioning as well. A lot of the oropharyngeal airways have a canal that you can insert the suction tubing through and be able to go ahead and suction them deeper, okay, than you would with a Yankauer, okay, smaller catheter suction, okay, so you can get direct access into the oropharynx and then into the trachea. Now, the next part is nasal pharyngeal suctioning. Now, this is when you're going to remove secretions from the nasal pharynx, and this is used even to get specimens sometimes, right? You might see them do this in the ER. They want to get specimens to check for any type of aspiration. Now, this is, for us in the field, is commonly used on patients who have an altered level of consciousness. And again, this is the type of thing where you're going to have an NPA inserted. A nasopharyngeal airway will already be inserted, and you're going to suction through the NPA. Okay, and again, the catheter is going to be a smaller size. You're not going to be sticking a big Yankauer through the nasal pharynx, through the NPA. It's going to be more of maybe a 10 gauge catheter or a 14, okay, things like that you're going to be able to suction through. Now, tracheal suctioning. This is for those patients that have that artificial opening. They have the stoma, or they have, let's say, a tracheostomy tube in place. And this is a lot of times when you're going to do this for those interfacility transports. If you're an interfacility transport provider, a lot of times you will be suctioning the stoma or the tracheostomy tube before you begin moving the patient, right? You're going to get any type of secretions that are building up removed. Patients that are on vents, you're going to end up doing suctioning as well. Okay. So the final one, and this is applies for paramedics, is the endotracheal suctioning. And this is where you're going to do it through the endotracheal tube, and the patient might be spontaneous breathing on their own where you're just assisting them, or they might be in respiratory arrest as well, and you're going to be ventilating them 100% and getting rid of any respiratory secretions this way through the endotracheal tube. Okay, there's a lot of indications for suctioning. We'll go over that maybe in a future Monday Minutes. Again, these are just quick videos here to give you an overview, and today I just wanted to go over the different routes of suctioning to sort of get you aware of it, and to maybe get you to look up some of the different methods and different sort of catheter sizes and suction devices you can use for each one of these routes. But again, we'll go ahead and I'll do some more videos in the future on the indications and some specifications for each of these different routes. So I hope you can use these Monday minutes in your day-to-day activities. If you have some of your own, be sure to send them over to me. My email is jhoff@emsseo.com. If you like this type of training and you feel this helps you, I encourage you to go check out Turbomedic, guys. It really is a all-in-one resource, and it's been proven at every certification level. You really can master any aspect of your EMS training and career goals. So click this Join Now button, go get some more information, and maybe I'll see you on the inside in the members area over at turbomedic.com. All right, guys, that's it for me. As always, Jim Hoffman for EMS Office Hours in the Monday Minutes. Stay safe.